Today, we are focusing entirely on the knee's role during gait, which is arguably one of the most clinically revealing joints when you're watching someone walk. The knee is unique because it's a load-bearing hinge joint that has to be both mobile and stable, and it has to rapidly switch between those roles multiple times within one gait cycle. If you understand the knee, you can usually reverse engineer what's happening above and below it, at the hip, ankle, foot, and even trunk. By the end of this lecture, you should be able to do several things. And I want you thinking clinically, not just memorizing angles. First, you need to describe normal knee kinematics and kinetics across the gait cycle. Not just what angle the knee is in, but why it's there and what forces are acting on it. Second, you need to understand how ground reaction forces influence knee moments, especially during stance, because ground reaction forces explain why muscles have to work, not just what they work. Third, we'll connect center of mass displacement to knee behavior. The knee is one of the biggest shock absorbers in gait, and changes here dramatically affecting energy cost. Fourth, you'll learn muscle activation patterns. Quadriceps, hamstrings, and gastrocnemius, phase by phase, including who's eccentric, who's concentric, and who's stabilizing. Then we'll move into common knee gait deviations. What causes them, why they matter, and how to correct them. Finally, we'll integrate EMG findings and show how this analysis feeds directly into patient evaluation and rehab planning. Let's start with normal mechanics, because if you don't know normal, you can't identify abnormal. At initial contact, the knee is typically at 0 to 5 degrees of flexion. Some people will look almost fully extended. That's normal. Immediately after initial contact, during loading response, the knee flexes to approximately 15 to 20 degrees. This is not collapse. This is controlled shock absorption. Think of it like a car suspension. If the knee stays locked, the force goes somewhere else. Usually the hip, spine, or cartilage. As we move into mid-stance, the knee begins to extend back towards about 5 degrees of flexion. This extension provides vertical support, so the body can vault over the stance limb efficiently. During terminal stance, the knee is near full extension, sometimes even slight hyperextension, depending on anatomy, ligament laxity, and gait speed. Then, in swing, the knee flexes rapidly to about 60 degrees in initial swing, allowing foot clearance, and then extends again during terminal swing to prepare for heel contact. If you ever see a patient whose knee never flexes or never fully extends, that tells you immediately where energy cost and compensation are happening. Ground reaction force is one of the most important concepts in gait and one of the most misunderstood. The vertical ground reaction force has two peaks, one during loading response and one during push-off. The key isn't magnitude, it's where the ground reaction force vector passes relative to the knee joint axis. During early stance, the ground reaction force passes posterior to the knee, creating an external knee flexion moment. That means something internally must resist flexion, primarily the quadriceps eccentrically. Later in stance, the ground reaction force shifts anterior to the knee, creating an extension moment, which reduces quad demand and allows passive stability. In late stance, the ground reaction force moves again, and knee stability becomes a balance of three things: passive structures, joint geometry, and gastrocnemius contribution. In conditions like knee osteoarthritis, we see alternative ground reaction force patterns: slower loading rates, altered peak magnitudes, which change internal joint loading, often increasing medial compartment stress. A clinical pearl to think about is that you can't strengthen away abnormal ground reaction force patterns unless you address how the patient is loading the limb. The knee plays a massive role in vertical center of mass displacement. During loading response, knee flexion allows the center of mass to lower smoothly, absorbing forces. If the knee is too stiff, vertical displacement increases, which increases energy cost and joint stress. If the knee hyperextends, you'll often see increased vertical oscillation as the body vaults over a rigid limb. From a theoretical perspective, timing of foot contact influences center of mass, acceleration, and displacement, which directly affects efficiency. Patients with stiff knees often complain of fatigue, not because they're weak, but because their gait is inefficient.